Hi, everyone. I'm Dr. Kenny Lin, family physician and associate director of the Lancaster General Hospital Family Medicine Residency. And I'm here today with Dr. Alka Gupta, who is on the board of directors of the American College of Lifestyle Medicine, to talk about lifestyle medicine and primary care. Dr. Gupta practices in Washington, D.C., and has been one of the leaders on the forefront of this new lifestyle medicine movement. In fact, I saw my personal physician earlier today, and he mentioned that he had attended your conference virtually earlier this year and was very enthusiastic about lifestyle medicine. So it was a great coincidence, but a perfect opportunity to talk about this. So I thought we could start with the basics. When you tell your patients and colleagues that you have training and expertise in lifestyle medicine, how do you explain what that is and how that could help them?
I think that's a great question and great place to start. I mean, when I'm talking with patients, we're usually talking about what it is that they want from their health. So we're usually tying it into whatever their goal is or whatever they'd like from their health. So if they're looking to live longer, live better, then sometimes we're talking about how a lot of chronic illnesses can be prevented or even reversed by optimizing lifestyle, like nutrition, physical activity, how we deal with everyday challenges. And if their goal is something else, then we might be showing that person how working within one of those lifestyle medicine tenets can help them achieve that goal. And then for clinicians, we know that lifestyle medicine has a massive impact on your health, both short-term, day-to-day, and also long-term. And so in my mind, that makes it relevant to everyone alive, and therefore it's relevant to all clinicians. It doesn't mean that everyone needs to know everything about it, but I think there's an increasing realization that this is part of medicine.
Yeah, I think part of the attraction of lifestyle medicine is that clinicians are encouraged to practice what you preach, that the 6 pillars of lifestyle medicine should be central to their own lifestyles and possibly reducing their risk of burnout. Could you tell us what the 6 pillars of lifestyle medicine are that are really the core?
So the 6 pillars that we really promote awareness of in lifestyle medicine are your nutrition, your physical activity, stress management, restorative sleep, social connectedness, and also avoiding risky substances that can actively harm your health.
I think of those pillars, the ones that intrigue me the most, and I'd love to talk more about, are stress management and social connection, because they're obviously really important to well-being, but it's not something that I guess I commonly talk about with patients as much as nutrition or physical activity, because I feel like sometimes those aren't really under my control. So I'm wondering how are there resources you provide or other ways that you allow patients to better manage their own stresses and spend more quality time making social connections?
It's hard, especially now, right? A lot of us live in a hybrid way. We work hybrid. I've seen a lot more isolation in the last few years than maybe there was earlier, which makes all of those things hard. I think with stress, it tends to be a kind of nebulous topic, and I think my first goal is to help a person, whether it's a patient or someone else, understand whether they're having a stress reaction that could be negatively impacting their health. A lot of us are working or living in stressful situations, and we might not even be aware of how that's exacting a toll on our health. And then once that happens, I find that the rest of the conversation becomes a little bit easier. And everything, I think, in life is a little bit easier to change if you have a bit of a community around you. It could be a small community. It could be a couple of family members, a couple of friends, colleagues, but community ends up being really important in making any change. For me, it's a lot easier to get physically active if I'm doing it with somebody else or taking a class or doing something that's connected to other people, because that makes me more excited about it.
So as medical training isn't always that conducive to living the healthy lifestyle. I can remember being on call and grabbing whatever there was to eat at the hospital cafeteria and neglecting exercise and things like that. Is ACLM like looking at changes we could make to training and medical practice that could improve this situation?
In general, there have been some improvements in the structure of medical education kind of across the board, right? So for good health for patients, we also need to be paying attention for good health for our teams and our healthcare workforce. We see clinicians leaving the profession often in droves, which is creating a massive issue. So we need to be able to take care of our own. I do think that medical education and training programs need to allow for basic things that are necessary for good healthcare, right? We need to be able to get to medical appointments. They need to be able to fulfill those 6 pillars that lead to good short-term and long-term health. So I think there's a lot of work to be done still, both within the medical profession and in other industries. I don't think the work is done, but I agree with you that it's extremely important.
I was looking on your website and noting that the ACLM has experienced a great deal of growth since it was founded a little more than 20 years ago. What do you think things look like for the next 20 years? Do you see lifestyle medicine as remaining anchored in primary care, or kind of evolving sort of the way that sports medicine has become kind of a subspecialty of primary care, or maybe some of both?
Yeah, ACLM has changed a lot. It started out as a volunteer-led, physician-led group that was quite small and quite grassroots. And then we've seen a lot of growth in the last decade. And we've led a major push to educate clinicians, both in training and after training, on how lifestyle medicine can be feasibly implemented into practice. As far as whether it needs to be anchored in primary care or elsewhere, I think what we need in order to transform health at a population health level or national level, or even at the individual level, I think we need depth. And so primary care will always be an important entry point, perhaps amongst the most important, but we can't rely on primary care clinicians to be doing all of that. There needs to be more depth than that. We need to rely also on other health professionals, nutritionists and registered dietitians, on exercise physiologists, fitness specialists, on behavioral health specialists, and then make sure that we're able to bring them in within a care delivery system that's connected, coordinated, communicates well, and kind of wraps itself around a patient. So while I think primary care is an amazing anchor, and that's why I'm in primary care, I don't think that we can just rely on it being in primary care. And in fact, it should be incorporated into all specialties as well, right? So if an endocrinologist or somebody is giving a patient a diagnosis of diabetes, nutrition has to be a portion of that conversation, so that the patient knows what's within their control with treating the diabetes.
Do you have a sense of what percentage of your members are in primary care versus like working in a more subspecialty environment?
I don't have the percentages. We have a lot of specialty representation, though. There's a lot of, cardiology is one of the more highly represented specialties, which I think is great. A lot of what we do in cardiology is prevention. And so it has a perfect place. And so if we're talking about advanced therapeutics or advanced diagnostics, even invasive tests like left heart caths and stent placement, it's really great that the same people are also providing a message about preventing the worsening of that issue, or preventing the issue like CAD in the first place.
Yeah, especially because in the purely cynical sense, like if you're a cardiologist and you're working in lifestyle medicine, you're trying to really reduce a lot of your business. Like hopefully people won't have to have invasive procedures. They won't have to have revascularization if you can prevent the disease from starting in the first place. I noticed that the ACLM recently published an expert consensus statement about integrating lifestyle medicine into primary care. And as you noted, it's not all going to be about primary care, and many of the services are pretty time intensive. But in terms of what we can do in primary care today, could you talk a little bit about shared medical appointments and other ways that family physicians and general internists can offer lifestyle medicine in their practices?
Definitely. I mean, we spend a lot of time trying to circumvent that exact problem, right? If you take one practitioner, like how many people can one person meet with and effectively take care of everything that they need in a visit. You can't do all of that. Plus also spend 20 minutes on teaching them how to have a balanced meal or what type of physical activity is best for them. So we often help support practices that use shared medical appointments or SMAs, where you can bring in multiple patients at one time, and using that group, there are a few benefits, right? One, for example, you can bring in other resources that might not otherwise be a covered benefit. So, for example, you might decide to bring in a registered dietitian or a psychologist or other practitioners that patients might not always have ready access to. And then you can do that education, teaching, and in a group environment that's also billable. So that makes it more feasible for a practice to be able to reach a higher number of patients with that information. And patients also love it because they get to learn from each other.
Is there anything that you want, or any take-home points you think that family physicians should take away from lifestyle medicine that we haven't already kind of talked about?
I think the key kind of catalyst for me was when I started realizing how much of chronic illness can actually be prevented in the first place, and then how much of it can actually be stalled or delayed even after the onset. And once I became aware of that, I think it became a lot more important to me to incorporate that into my everyday practice. So I really think that that's the most important thing to know. And then I think clinicians are intrinsically motivated to want to do the best for their patients. And so you tend to find ways and resources where you can bring in the things that you may not have the capacity to do yourself. I think that ACLM has a treasure trove of resources that practices can avail themselves of. And I think it's also a really amazing community to get involved in and to meet. And there's a lot of inspiration that happens in conversations like that.
Well, I think many people in our audience are definitely ready to receive the message. So thank you so much for taking the time to speak with me today about lifestyle medicine.
Thank you.